Hello again, everyone. So this video is going to be your Unit 1 and Unit 2 video. So what I'll do is I'll go in sequence. I'll start with Unit 1 and then we'll transition into talking about Unit 2. So for Unit 1, we're really just getting kind of introduced to the counseling profession. So the professional orientation, the code of ethics, and, really connecting with this profession. So what you're going to do as far as assignments is you're going to read Chapter 2 in Halkowski, and also you're going to take a look at 3 other supplemental kind of reading materials that are going to be in the unit folder for you. So first and foremost is the ACA Code of Ethics. So the Code of Ethics is something that counselors are expected to abide by in the sense of, ethical decision making. So you as a counseling professional are almost always going to encounter some type of ethical dilemma within your career, probably multiple if we're being realistic. But this is anywhere from, kind of stipulations on social media, getting friend requests from people that you might be working with as clients, dating regulations, all kinds of things. So for this reading material, you don't necessarily need to read the whole Code of Ethics word for word. Just take a gander. They are split up into different sections, so they each will have a different bolded title for each one. So take a look at the different sections there are. If there's any that pique your interest, go ahead and read a little bit more into it. In your unit assignment, you are going to see that there is a prompt asking for you to talk about, which ethics you think that might be the most difficult for counseling professions to kind of stick with and follow, and some that might have piqued your interest. So like I said, don't feel like you have to read it word for word. There are 2 other supplemental articles that I'm going to ask you to read. And then you're also going to watch a TED Talk. So a lot of students have already seen this TED Talk, whether they are, Brené Brown fans themselves. This is a pretty old video, but I'm pretty sure that this is what put Brené Brown on the map for people. She's very well known at this point, very widely discussed, whether it be in the workplace or just, being a manager, that kind of thing. But you're going to watch the Power of Vulnerability video that talks a lot about, why it's important for us to be vulnerable with other people, no matter what capacity you might be working in. Then you're going to complete the Unit 1 assignment, journal reflection number 1, and then quiz number 1. So for the unit responses, the unit assignment responses, as well as the journal reflection, remember 250 words per response, okay? For journal number 1, the response here that you're going to go off of when you're completing your journal and putting it in the Dropbox, the prompt is, the APA requires some accredited programs to incorporate cultural competency training into their curricula. In what formats do you think such training would be most effective or beneficial? And what format would you personally prefer? What I mean by format is there is a number of different ways that one can really be taught cultural competency, whether it be in an undergraduate program, a graduate program, that kind of thing. And so when I say which model or which format, I'm saying, you could just take a 3-credit course on it and learn about it and just do that material. You could be expected to have interactions with clients from various cultural backgrounds. You could be required to go to a training or a seminar outside of the classroom, that kind of thing. So in what formats do you think people would best learn about cultural competency and learn about other cultures? Get creative. Tell me what you think. So that's journal number 1. For the quiz, as promised, we talked about getting 2 quiz questions answered. So there are 2 questions that I have noticed students typically struggle a little bit more with each semester. So the first question is, a professional counselor is considered to be a clinician with a master's degree or higher. This is a true or false question. The answer is actually true. So when we're talking about professional counselors, those are people who have gone to some additional schooling to really focus in on a particular area or a particular element of counseling. So one is a professional counselor once they have completed a master's degree. If you have any questions about that, please let me know. And then the other one, let's see, where did it go? The other one is kind of in line with the journal reflection question or prompt. When considering a diagnosis, it is required for counselors to consider the client's blank blank, as this affects the manner in which a client's problems are defined and experienced. The answer to this is cultural experience. So there are a number of ways, when we're diagnosing in, one of those appropriate counseling professions, where a person's culture might kind of be, when we're talking about like the diagnosis criteria, and we take a look at someone's culture, there are things within criteria that could be impacted by someone's culture. So it could seem like they met criteria for this particular diagnosis, but when we take a step back and we're kind of taking a look at their cultural experience and cultural beliefs, it's like, okay, that doesn't line up. This diagnosis probably is not appropriate. So we want to make sure that we always address someone's cultural experiences when we're taking a look at diagnosis. So hopefully that is helpful. All right, so I think that's it for Unit 1. For Unit 2, we are going to be focusing in on clinical mental health counselors and addiction counselors. So I actually serve in both of these roles. So I am an LMHC and I also have a CASAC-T. So what you're going to do for Unit 2, you're going to read Halkowski chapters 3 and 6, which are the corresponding chapters to these particular counseling professionals. You're going to watch a video titled What Happens in Counseling. You're going to read one supplemental article, complete the Unit 2 assignment, complete discussion board number 2, and then complete journal reflection number 2. So, some things to kind of think about. With clinical mental health counseling, this is where things get a little confusing. This requires a license. Licenses are basically given per state. So each state has their own requirements or criteria for what makes someone appropriate for licensure. When we're taking a look at the addiction counselor, this is actually a state certification. The difference between the two of these is for billing purposes. So clinical mental health counselors can bill insurance companies with their license. Addiction counselors with a CASAC, which is a certified alcohol and substance use counselor, they can only bill for particular things. So that's where things get a little tricky. So for an LMHC, licensed mental health counselor, someone would have to go and complete a graduate program similar to mental health counseling, complete internships, complete 3,000 hours postgraduate experience that's supervised, and then they can sit for the licensing exam. Once you kind of get through and pass all that, then you can become licensed. When we're talking about CASACs in New York State, these certifications were actually created for individuals who might have experienced some type of struggle with substance abuse. And so what they were looking at is, how do we make it so that it's easier for individuals to become certified if that's the situation that they're in? So for a CASAC, one actually only has to have a high school diploma, and they would have to make sure that they met all of the educational criteria and the experience criteria before sitting for the certification exam. So there are some local colleges to Buffalo, such as like ECC, that has a CASAC track where for 2 years you go and you take all of the courses that one would need to become a CASAC and that kind of thing. So a lot of difference between the two of these professions, but the hard thing is that a lot of treatment is integrated, which means that, an individual can come for mental health counseling as well as substance use counseling because those two usually coexist for individuals. So while clinical mental health counselors and addiction counselors can be very separate, they can also be very similar and kind of interchange in counseling and the roles that they have. So credentialing there is like the biggest piece, and like really where that comes into play and where that's important is like when jobs are hiring. Generally, they're probably looking for someone more so with a license if they are providing clinical work so that they can bill insurance companies. I hope that makes sense. So if you have any questions on that or that's something that piques your interest, please let me know. Okay, so for discussion board number 2, one of the things that I have really tried to do in this course is provide reading materials, TED Talks, and reflection questions that are relevant to someone who might be in that counseling profession. So trauma-informed care is a big thing, whether you're in the counseling professions or not, but even more so in the counseling profession. So in clinical mental health counseling and addiction counseling, the rates of trauma are very, very high. So your chance of experiencing or encountering an individual who has experienced a bit of trauma is relatively high. So that's why I incorporated trauma-informed care into this course. So what you're going to do is you're actually going to watch a TED Talk for this discussion board. It's going to be by someone named Dr. Kelly, where she goes through and talks about trauma-informed care. And you're going to, kind of reflect and answer with some given prompts from that video. So that'll be discussion board number 2. Remember, your initial post should be 250 words, and then you should have responses to 2 classmates that the word count is very similar. One thing that I did note in the tracking calendar for discussion board number 2 is Dr. Kelly does mention the adverse childhood experiences study. If you can, hold off on looking that up if that's something that piques your interest, because we're actually going to get really into it in next week. So let's take a look at journal reflection number 2. As we are considering our topic for the advocacy paper, let's be sure that we know what is meant by the term advocacy and what it looks like. So in your prompt or in your response for journal number 2, when you hear the term advocacy, what comes to mind and how can we or you advocate for others? So like I said, we're going to talk a little bit more about the advocacy paper next week because that's going to become very relevant very soon. But let's make sure we know what advocacy is first. So if you can do that for me, that would be great. Other than that, I do believe that is it for units 1 and 2. So this unit is going to start on the 20th of December and it's going to wrap up on the 4th of January. If you need an extension, make sure you get the request in before the 4th. This is not a good semester to fall back behind on work. So just make sure if that is something that you need, that you're not setting yourself up to get behind for the rest of the semester. If you have any questions or you need anything, feel free to shoot me an email. All right, I'll see you next week.